turn things over to Dr. Lonnie Zwaigenbaum for the closing remarks. Dr. Zwaigenbaum is professor in the Department of Pediatrics at the University of Alberta and a member of the National ASD Advisory Committee. His research focuses on early detection and diagnosis, factors influencing development and lived experiences, and approaches to optimizing healthcare in individuals on the spectrum. He has been a researcher with KBHN since its inception back in 2010. And afterwards, I will be back to give you some final reflections for the first ever Kids Brain Health Network virtual conference. Lonnie, it's over to you.
Great, thanks so much. Wonderful opportunity to have the chance to close out this wonderful conference. When Jen Zwicker first approached me to ask if I would give some of these final thoughts, like what an incredibly daunting task to reflect on not just this incredible 4-day conference, but also the last 10 years of Kids Brain Health Network. But also what a wonderful opportunity to kind of have these final words and also to spend this next half hour with you. It may be a little bit different at a virtual conference, but I think most of us realize that you attend these conferences. They're exhilarating. They're kind of draining, and it's Friday afternoon at 4:30. And I think it's probably fair to say that the people still in the room are those that have Kids Brain Health Network close to their hearts. And your investment and commitment and engagement are really what makes the network such a special thing to be part of. So I'm really excited to share these final thoughts with you. So looking back 10 years, so I was thinking about those early years of the network, and first of all, what a remarkable achievement it was that a group focused and interested in neurodevelopmental disabilities would be able to come together and be successful in securing support from the National Centers of Networks of Excellence. A federal funding mechanism that was largely focused on commercialization and economic development. So the idea of layering in the needs of the neurodevelopmental community into that kind of mechanism was really a very challenging task and a huge accomplishment that brought together a group of researchers, to some extent at that point, families and other community partners to think about what we can learn together in moving the world towards a better place for people living with these conditions. However, the truth is, it was very much through a scientific lens. The conditions that were selected were largely selected because of where they sort of stood on the continuum between genetic and environmental influences. So very much kind of a scientific and technical lens. And there was certainly a focus on working towards better treatments, better opportunities for children with cerebral palsy, fetal alcohol spectrum disorder, and autism. But the truth is, from the outset, it was a network that was very much focused on generating data, kind of discovery science, and kind of with some confidence that as we used to operate in a somewhat passive way, that the findings from this research would kind of percolate into the community, into the clinical community, and into the lives of children and families. So fast forward 10 years, and isn't it remarkable where we're at? Just the clarity of the purpose and vision of the network, specified in this infographic here, that all children with neurodevelopmental disabilities will enjoy quality of life, inclusion in all aspects of society, and an opportunity to reach their full potential. And just scanning some of the elements on this slide, just the incredible sense of contribution and community, the shift to co-production of research with parents, with others with lived experience, and the increasing focus on what we can accomplish together. So as I commented, at the earliest years of the network, there was very much a focus on discovery science. A lot of our early work was focused on genetics and neuroimaging and laboratory studies that were really fundamental in providing new scientific insights about these conditions. And I think also importantly brought together the scientific community in a way that hadn't been successful before. I think particularly, and I hope James doesn't mind me saying so, particularly for the fetal alcohol spectrum disorder community and the cerebral palsy community, these were a group of national scientists working in different disciplinary areas, many of whom hadn't necessarily collaborated or interacted before, and sort of really brought them together under this umbrella of the network to really pool their energies and passions and work towards a greater interdisciplinary approach. But as I commented earlier, a somewhat siloed approach around particular diagnoses and very much focused on scientific discovery. The next phase of the network was characterized by a bit of a move outside of the lab, outside of approaches like genetics and neuroimaging, to really think about what we could do to really help improve function and opportunities for participation, and a greater emphasis on novel interventions, understanding some of the clinical challenges faced by children and families, and a really fulsome effort to think about how we can work together in a much more productive and respectful way as partners. So that shift to a culture of co-produced research and the notion that we don't sort of push our way into other communities, but we invite and create a bit of a pull, something attractive to work towards together. And it was a time of actually implementing some of these exciting ideas. So the cartoon here comes from the manual of the social ABCs, which was developed by a wonderful colleague of mine within Kids Brain Health Network, Jessica Bryan, as well as Susan Bryson. And it was an opportunity to try something new in terms of supporting the early development of children with early signs of autism, but still on a relatively small scale. And now looking to where we are today as a network, and the clear momentum and focus on creating impact, thinking about the interventions and how we can scale them up into the communities, working even more closely with people with lived experience, including those who part of their life is having a neurodevelopmental condition, and also family members, to think about what are the priority needs, how do we work together to implement these, and how do we connect with the broader clinical and policy community in order to continue to generate insights of where we take the network next. And I think that culture was very much reflected over the last 4 days in this conference. There's been some absolutely wonderful sessions that really reflect some of the key characteristics of the network. I mean, one is that the incredible responsiveness of the network. Jennifer Corbier just commented about sort of how remarkable it is that as a research community, we've been able to adapt to the changing world. And I think we also have a really profound respect, not so much for our research colleagues, but also for the children and youth and parents that we're working to, that have had a lot more to navigate and to adapt to. So it's been wonderful to have sessions on service delivery during COVID, defining the new normal, thinking about our research, not just in terms of generating new data, but actually practical tools for families. The session on advancing navigation that was co-led by a colleague of mine in Alberta, Dr. David Nicholas, who with Dr. Lucy Locke has led this wonderful project, really helping understand sort of what life is really like as a family trying to navigate these complex service systems, and really exemplifying Kids Brain Health Network's commitment to partnership with community leaders who support families in their day-to-day challenges with the service system. The session on Luke's legacy, really talking in a really insightful way, a number of the panel members about the meaning of being a family research partner. Wonderful session this morning. I learned a lot about integrating rights-based frameworks into policy and practice. really quite inspiring, the work that's been done nationally and internationally. And again, also, I'm really left with the words from Krista Carr about the new normal in terms of what children and families are facing, and applying that conventions for rights of persons with disabilities in terms of thinking about sort of what at this point is unacceptable and what we need to be continuing to advocate for. You know, I think a lot of us are reflecting on these new times, and I apologize for the jokey reference here. And in kind of full disclosure, I have not actually read Love in the Time of Cholera, which is a wonderful and complex love story. I did read 100 Years of Solitude as I was graduating from high school, which in some ways is the Gabriel Garcia Marquez book that maybe more exemplifies sort of what our experience has been over the past several months. But again, to really emphasize what a number of speakers have said, everything is different. We've really had to, certainly in the clinical community, re-examine our priorities to maintaining clinical supports. You know, what really matters when it comes to assessment and service delivery, and how do we make sure that we're addressing the priorities of children, youth, adults, and families. It has been a time of experimenting and innovating. I mean, it has been remarkable, particularly sort of working with our trainees and people starting out in their careers. It's really sort of tapping into their creative energy in terms of finding new ways to approach things, to adapt, and maybe come out of this pandemic with some important new insights. At the same time, I think there are many of us that have multiple roles, sort of working not only in research, but in clinical contexts. And I think we're recognizing that our responsibility primarily is really to do all we can to support children and families. And again, with the profound respect and concern, knowing to what extent they've had to cope with disruption at every level, their family routine, their services, their educational programs, and their sense of community. And again, as Krista commented on, not only are we having to adjust to the pandemic, but we're really having to grapple and acknowledge with the chronic issues that have been essentially unmasked through the pandemic. The issues of disparities and with respect to access to services, access to assessment that's experienced by people from with differences in terms of ethnicity, from socioeconomic differences in terms of geography, recognizing that the system does not work equally for all persons, recognizing that our services are often highly siloed with inadequate communication between the health, education, and service systems. And recognizing that whatever stage of career in, we need to make a more active effort to learn and adapt and to be constantly listening to the needs of families. You know, I've heard colleagues comment that at one level we're pining for normal, but kind of looking back, maybe normal wasn't all it was cracked up to be. And I think there are a lot of lessons that we need to take away about what we've rediscovered is important, and the real kind of gaps and inadequacies in the system, and to be able to move forward with a renewed sense of vision and purpose. There has been some really insightful research and reflections that have come out in a relatively short period of time, and it has been inspiring working, being part of a research community that's been able to reflect, to adapt, to come up with innovative new practices, and to listen to the experiences of children and families. This is just a small sample, and all with a bit of a focus on autism, and I want to particularly highlight a paper that came out of a roundtable led by Dr. David Nicholas, whose leadership role in the navigation project I mentioned. And he brought people together from different areas of pediatric practice to reflect on the challenges that they're facing within the clinic and hospital, the challenges that are being experienced by their clinical teams who are losing that sense of support and teamwork, being redeployed to other areas of health functioning, and we're certainly facing this right now as we're in the second wave of the pandemic. And again, most importantly, the challenges being faced by families and the lessons that we need to think about, not only if we were ever to face another pandemic, but really sort of what we could be doing better in our day-to-day practice to address these issues that have come to the surface. Certainly one of the highlights for me at this conference was the Ask the Expert luncheon. And I have to say, it's always a bit embarrassing to kind of be the person kind of sitting in that expert chair as part of the discussion. And I always get so much more out of these discussions. Oops, I'm just gonna go back. There we go. Sorry, I must have hit that twice. I get so much out of the discussions, I think, than anyone else at the table does. And some of the really important themes that came up at our table, you know, the people who are connected to KBHN, trainees at different stages, who are interested in having a career that really addresses both their clinical and their academic passions, and recognizing that that clinician scientist track isn't readily available to many trainees, particularly outside of health faculties, particularly the physician faculty. We heard from a parent who brings an incredible wealth of insight and expertise, both from her lived experience and many professional experiences, who's trying to find her place in terms of being at the table to be able to inform research, inform local practice. And there was a great connection made just in the networking that occurred at that table. And then just in general, you know, most of the people who attended that sessions were trainees at different stages, and the pandemic has been extremely difficult for them as well. You know, kind of thinking about being at a conference, I mean, Doug Swanson and the team did an amazing job of kind of replicating in the virtual conference what it's like to kind of wander around and not really know where you're supposed to be, but kind of bumping into colleagues or acquaintances or new people that you wanted to meet. But still, it's not quite the same as having a senior person at your field come up and ask you about your poster, or the chance to meet with someone on site to talk about a new career or training opportunity. But there was a lot of creativity in ideas that came from the group about how still to take this opportunity to think about those networking opportunities, to reach out to people in the field who I think are actually really receptive, kind of given the current circumstances, to hearing from people who are interested in pursuing careers in their area. But in general, we really need to make an effort to support our trainees through this extraordinary time where they've lost this sense of connectedness and also opportunities to explore different career routes. And then we've had this incredible session this afternoon on the road to Canada's National Autism Strategy. And it was a pleasure having a chance to hear Jennifer Corbier speak about the strategy as well in her leadership role with the Public Health Agency of Canada. I think this partnership between Kids Brain Health Network and CASDA really exemplifies the power of the passion of service providers, parent advocates, and trainees who come together with a fresh perspective, that combines sort of that creative academic energy with people with passion and lived experience. I think you'll all agree, just the insight, the depth, the specificity of the recommendations, and the sophistication of the process, I think sets the bar really high and provides a really strong foundation for moving along this road to informing a national autism strategy. Something that's certainly been on my mind a lot for many years, but certainly in the last little while. And I really look forward to working with this incredible community who've done such foundational work in this area. I also think this is a real blueprint for thinking about national strategy and national policy in other areas. Jennifer encouraged, when we first spoke about this talk, to sort of think about lessons and reflections from other national initiatives. And again, it's like a huge debt to the Public Health Agency of Canada for their leadership in supporting informed practice in autism and generating the data that's really guiding national decision making. And for me, kind of wonderful professional opportunities to kind of learn the power of being involved in an initiative that generates new sources of provincial and national data. The National Autism Surveillance System was really born out of the discussions at the Senate subcommittee about 15 years ago, which generated the Pay Now or Pay Later report. And again, sort of on, you know, it really reflects the passion and advocacy of parents who are really looking for a better world for their children. And one of the ideas that came out that has now been fully realized in this report from 2018 and an ongoing surveillance system, the first national data on not only numbers of children being diagnosed, but also important clinical correlates and variation across provinces, and an opportunity to create a longitudinal perspective on how the landscape is changing for autism. And again, I think an important blueprint for other conditions. The Public Health Agency of Canada also laid the foundation by supporting a systematic review and then creating a partnership with the Canadian Pediatric Society that welcomed a task force that represented professional groups across the spectrum, including parent leaders, that generated our, kind of not our necessarily our first national guidelines, but sort of the latest national guidelines that does reflect this partnership between the clinical community, professional societies, parent leaders, and to provide a bit of a made in Canada approach to early detection, diagnosis, and ongoing pediatric care that's evidence informed, but also is intended to reflect the diversity and to leverage the strengths within the community across Canada, and recognize that a one-size approach to clinical care in autism and in all developmental conditions does not work. I think where we still have a lot of work to do, and I'm very cognizant of this speaking at the Kids Brain Health Network, is that these are developmental conditions that affect people throughout their lives. And right now there's a very heavy emphasis on generating data and a focus on the service system kind of at that early end of life. But we know that these are conditions that affect individuals throughout their lives. And we also know that people with neurodevelopmental conditions such as autism enrich our lives and they provide fundamental contributions to societal life, and yet the service system, even basic opportunities for diagnosis, and then opportunities to further participate, engage, and contribute are really underdeveloped. And we need to use this as a foundation to really think about the system that we can build for adults, and to do that, as KBHN has really led as an example, together with people with lived experience. So a few final thoughts. So first of all, your research matters. That was certainly readily apparent to us as we were working on the Canadian Pediatric Society guidelines. And it's not just research that comes out of large multi-site national, international networks. It's research that's done in small clinical and research teams in large and small centers across Canada. It's graduate work and work of summer students that are being done to evaluate measurement, evaluate lived experience, evaluate service systems and opportunities for children to better participate. It may feel sometimes that the paper is sitting on a shelf and not sort of being considered, but I have to say, particularly with the rapid move to sort of open access and greater public sharing, your research is making a big difference. I think the culture of the network, and also sort of working across that diversity of perspective and diversity of stage of career, is also important in terms of challenging the status quo and the received wisdom. The notion, for instance, that autism can only be diagnosed by a multidisciplinary team at a tertiary care center at a large urban center. And again, it's people in the community and people at early stages of career that are really challenging us to rethink our assumptions. Our research certainly needs to reflect the diversity of children and families whose care really depends on this work. We need to continue to provide authentic engagement of partners with lived experience to infuse that perspective throughout the process and make sure that we're addressing the right questions in the right way. And I have to tell you, there are a lot of important questions that remain to be answered. And, another reflection is that team development and functioning matters as well. I mean, I think, like many of you in the group, we all wear multiple hats. And about a year ago, I took on a clinical leadership role as the pediatric department head in the Edmonton area. It's interesting trying to integrate all these roles. Immediately after this conference, I have to meet with a colleague to work on kind of a COVID exposure case tracing. So it's sort of the reality of what we're living in. But it's certainly given me the opportunity to kind of reflect and sort of draw on some of my experience from the academic world in thinking about sort of how to be successful sort of in this context and vice versa. And in that respect, I've had the opportunity to kind of reflect and sit with other people in similar roles and think about sort of frameworks that are applied sort of outside of the health research arena. There's a wonderful book written by someone named Patrick Lencioni who really writes these wonderful stories that really exemplify and get people thinking about key aspects of leadership and particularly key aspects of creating a successful team. And the foundation of it really is creating trust, that sense of that trust and respect, a safe place for people to contribute their perspectives and a belief that we're working towards a common goal. The other one I'll highlight is a characteristic of a dysfunctional team is a fear of conflict. It's, I think one of the wonderful things in KBHN and a number of other initiatives that many of us are involved in is, not having to shy away from having difficult conversations, to be able to recognize that there are genuinely differences in belief systems and perspectives, and that we need to not be afraid of having that healthy conflict and that opportunity for radical candor, to be able to give direct feedback about what's working in the system and what's not, and ultimately sort of working towards results. But I think KBHN, the culture has really kind of shifted our thinking to recognizing that the attention to results isn't so much verifying a hypothesis or getting a manuscript accepted, but really ultimately ensuring that that our research moves us towards that pathway to broader impact for people with lived experience, for families, and for society. I included this photograph in the slides that I showed at the Meet the Expert Luncheon yesterday. And I was reflecting on it last night, and there were a couple things that occurred to me. I mean, one is that, for the first time in my life, I feel like I'm looking a lot more like Yoda than like Luke right now. And it's certainly been a tiring time. The other thing, I kind of look at Luke and he's vibrant, he's adventurous, he's going to kind of race in and solve the problems of the world. But then there's Yoda, who's kind of hanging back, and he's reflective, he's spiritual, he's aware of his surroundings, and he draws from kind of the wisdom of the ages and also of his kind of extended community to kind of inform Luke and to have that broader vision. And even though I feel like I look a little bit more like Yoda and wish I could still feel a little bit more like Luke, I actually feel like it probably helps to have a little bit of Luke and Yoda in you. And I think that's probably true for most of us. So just some final reflections on opportunities for the next decade for KBHN and for all of us. From a kind of technical and content point of view, and some of these issues have been touched on in the conference, one of the initial focuses of our network was thinking about early detection and diagnosis. And over the period that we've been working together, there have been some very sophisticated approaches that have been developed, neuroimaging, biomarkers, we're moving to this whole era of precision medicine. How do we actually integrate these new technologies into our kind of clinical experience and sort of existing conventional behavioral tools to kind of advance our goals of earlier diagnosis, and not just thinking about measurement issues like accuracy, but rather also about what does it mean to be a family whose infants are being asked, who are being assessed using these technologies. What does it mean to be detected earlier in life? And ultimately, what's the long-term impact in terms of access to services and longer-term well-being? We need to continue to grapple, especially as we push the envelope around earlier intervention and, frankly, interventions across the lifespan to greater non-categorical approaches to both the specific treatments but also service design, drawing on the wisdom and experience and expertise of many people within this network to really focus on thinking about function, social participation, and opportunities to fully engage in society rather than just specific behavioral endpoints. you know, we've learned a lot from working with parents, and I'm proud to be part of a network that has such a strong partnership or relationship around co-production of research. And this network has also advanced partnerships with youth with lived experience. But I think that we still have a long way to go in terms of working alongside youth and also adults with lived experience, and ensuring that they are able to inform and really sort of better our approaches at all stages of the research process. And then again, you know, in terms of thinking about the pandemic, you know, we are ultimately developmentalists working in a kids' brain health network. And in development, there's no turning back. So, you know, we've kind of blown up the system through COVID. Let's not just go back. I mean, let's think about what we've learned, the sort of the innovative things that we've been able to do, you know, opportunities for greater access even to a national conference like this by being able to sort of spend the afternoon together online. But more importantly, not forget about sort of the curtains that have been pulled and the masks taken off in terms of things like disparities and fragmentation in the system, and recognition of all the things that we've been a little too complacent about, and make sure that we infuse that both into our next set of research questions and also in terms of our advocacy when it comes to clinical practice and policy. So with that, I'll just land on this final slide. So this is my son. The photo was taken probably just before the network was created. You know, as always, my son was like just completely uncooperative. I wish he was wearing kind of rose-colored glasses because it would be a better visual for the note that I'm trying to add on. But I still hope that his joyful smile will kind of really exemplify the sense of optimism that I feel in looking ahead to the next 10 years and beyond, sort of working with all of you and thinking about what we can accomplish together. So again, thank you for the opportunity to be a part of the conference, and I wish all of you a great weekend. Thank you. And now back to you, Dr. Goldman.